Indeed, it is a good evening to you, Griselda, and of course to all those watching this evening. COVID-19 certainly impacting not just our daily lives, but certainly the globe. The economic impact is bound to be massive and absolutely huge, and that is what we're going to focus on as well in particular now. The response then from the economic front, not just by governments around the world, but certainly by central banks as well. How much have they cut interest rates by? How significant a deal is that then to economies that continue to struggle? Africa has certainly been one that has found itself in a very difficult situation. There's hardly a country in the world that could claim to have not felt the immediate impact then of COVID-19, and especially then right down to our Brics counterparts, Brazil, Russia, India, and of course the initial epicenter, China as well. So how much impact will it have then on them as emerging markets begin to suffer as well? As I've just said, we will feel it here locally too. Today, the Brics National Bank managed to give out then a loan of around 5 billion renminbis, which equates to around $700 million. And that was then aimed at trying to fund and help and give a loan then to China. It does follow on the announcement of a 7 billion renminbi loan as well to China to try and fight the epidemic as well a little bit earlier on. Let's chat about all of this now. Leslie Maasdorp is also CEO and CFO and Vice President then of the New Development Bank, and he joins us online. Leslie, thank you so much. I take it, though, that the bank is fully operational at a time like this. Why and what exactly was the purpose of this loan?
Thanks, Rabila, for having me. The bank has been operational since the crisis erupted in Wuhan and other parts of China. So the bank has been fully operational, although many of us worked from home. We now have almost 2/3 of our staff back in Shanghai, so we're fully back in business. The loan you're referring to, Arabella, is quite significant. Firstly, it's the largest loan of the bank to date, and it demonstrates the capacity of multilateral banks like the New Development Bank to respond in moments of crises. As you know, banks like ours, the World Bank, Africa Development Bank, etc., we're traditionally known for building infrastructure, bricks and mortar infrastructure. We build dams and power stations and ports, the rail and so on. But this year we've responded for the public health emergency. The loan we're providing to China of $1 billion, which is about 7 billion renminbi, is specifically focused to help the country manage the impact of the pandemic. Sure. So the loan will go towards, the increasing capacity of hospital beds, ventilators, protective equipment and gear for frontline health workers, and so on. So all of the essential medical supplies that many of the BRICS countries will need, this loan is indicative of the kind of support that the New Development Bank can provide to BRICS countries. So the size is $1 billion.
Yeah. So, Leslie, are we saying then that South Africa could get a little piece of what is in the New Development Bank with regards to assistance then as well with regards to this COVID-19 pandemic?
South Africa, as you know, with the other BRICS countries, is an equal shareholder in the New Development Bank. The bank stands ready to assist all of our member countries. As you know, the rate of spread of the pandemic is at various stages in all of the BRICS countries. China was obviously the epicenter, and the crisis was in a completely different, in terms of proportion, at a different scale altogether. It is still early stages now in Russia, as well as India and South Africa. Brazil, I understand, as of today, already had more than 200 deaths. So the crisis is expanding there. The bank we are in active dialogue with all of our member countries. And South Africa is talking to all of the multilaterals to see how best we can complement the government's efforts to fight this pandemic.
Leslie, what form would an assistance then from the New Development Bank sort of take in South Africa, for example? Would it be dependent on the type of request that is made, or would it be a decision made by the BRICS New Development Bank?
We are very much, Arabella, demand-driven. We'll be driven by the needs and demand of the South African government. As you heard earlier on in the program, Dr. Mkhize and his team, they're very well on top of managing this pandemic. So the bank will not dictate to the country the nature and form that the support should take. However, as you know, there are two dimensions to the crisis, which you've already spoken about. Is the public health short-term crisis. And then the second order, which is as important, is post the pandemic, the targeted economic interventions that will be needed to restore us to some form of normality after the pandemic. We are very much focused now on modeling and looking at what are the likely impacts that this virus could have under different economic scenarios. Yeah. For now, we are focused on the immediate, which is safeguarding lives, safeguarding livelihoods, and dealing with the public health emergency.
Let's get to a total number in terms of support that the New Development Bank has offered to date. Is this the first of its kind?
This is the first loan of its kind focused on the public health emergency. Yeah. For each country, we have a number of around $2 billion per annum. That is the total scope of the bank's commitment to each of the five countries. So obviously, if we commit up to, let's say, $1 billion, we will, have another $1 billion we could commit to other forms of infrastructure. As I said, we're very much focused on casting our eyes forward, looking at beyond the pandemic, because we must look at what sorts of economic activity could stimulate growth again, because we are going through troubled times. We've just been downgraded, and we need to find those ways in which we can increase output and economic activity after the crisis. So in short, there is a package of measures that the bank is looking at. The short term will be for medical supplies, protective gear, testing kits, all of the things that the minister spoke about earlier on. And the second phase will be more the kind of economic support to get the economy back on its feet.
Very quickly, the aim then also of the BRICS Bank was not just to help the BRICS countries, but really a few emerging markets. Have you found any requests outside of the BRICS nations as well? And who, if you don't mind us asking?
I mean, as you know, multilateral banks are very uniquely positioned in moments of crises like these, Arabella, because, as you know, these banks have mandates that are global in character. We are dealing with challenges. A global pandemic is something that you cannot solve in one country. You can only solve it in a multilateral sense, looking at it together in terms of global solutions. The bank, however, at its core, is focused on providing support to its member countries, because that's what our articles dictate at this point. However, we are looking at initiatives, ways in which the bank can expand its support so that it can have more regional impact. South Africa, for example, as you know, is very much integrated into SADC. Our countries are dynamically interconnected. We have large numbers of workers, who live across, who work in South Africa, but are from Mozambique, from Lesotho, from Swaziland, from Zimbabwe, and so on. So whatever solutions we come up with here has to take that regional dimension into consideration.
Leslie, appreciate the time. Leslie Maasdorp there is the Vice President as well as CFO then of the New Development Bank, of course, the Brics New Development Bank, speaking to us there via Skype. Look, let's stay in China for a little bit. That country will begin reporting asymptomatic cases, so people that don't show the symptoms then of coronavirus. That will start on Wednesday, and that will be included in the overall rate of